Welcome to New Horizons. I'm Suzanne Barnett, your host, and tonight I am so pleased to introduce my guest, Dr. Preston S, who is a chiropractor, and he has his master's in sports science and rehabilitation. Tonight, Dr. Edwards is going to help us with all of his information. We are going to have exercises, and we are going to feel better forever. How's that? I'm so
good.
glad you're here.
Thanks for having me.
Well, I know a lot about you, and I had to say all of that. First of all, tell us about chiropractic.
Sure. Well, essentially, chiropractors work under the premise that your body is a self-healing, self-regulating organism. So basically, try to use as little outside intervention and get the body to optimize and heal itself. And we do that through chiropractic adjustments by moving the bones in the spine to affect the nervous system, as well as by giving nutrition, exercises, and different things like that in order to help the body heal.
So there are no drugs.
No drugs.
No surgery.
No surgery.
And just a handsome chiropractor.
If you needed some drugs or surgery, would you know where to find that?
Yeah, I'd have.
You would.
Yeah.
So there's also practitioners out there that prescribe other things to heal you as well.
But you work now with the doctors, because we were talking about the fact that chiropractic had such a bad name for so long, but now it's very in to go to a chiropractor as well as your medical doctor. Tell us why.
Yeah, very much so. I think chiropractic has become a lot more mainstream these days. For whatever reason, I think there was a little bit of a rift between maybe traditional medical practitioners and doctors of chiropractic, but I've basically been trained in an integrated medicine facility, which basically means we want to do what's best for the patient, no matter what that is. If that individual does need drugs or does need surgery, then that's where they're going to go. If they need a massage therapist, that's where they'll go. Maybe they need acupuncture. Maybe they need chiropractic. Basically find the solution for them that's best for them and not just trying to put your own interests first.
So my next question, Preston, is do you think everyone should go to a chiropractor?
Absolutely.
Okay, why?
I think everyone should have a medical doctor. I think everyone should, or some primary care physician. Everyone should have a dentist, and everyone should have a chiropractor, because you don't want to be in that acute situation or in an emergency and say, "Hey, I'm feeling terrible. Now I'm going to find somebody." Already have somebody on that healthcare team that you can rely on, that you know, that you like, and that you trust. It's kind of like finding a mechanic once your car breaks down. You want to have one before then.
And one of the things we were talking about is the fact that, say, a patient comes to you and you help that patient and you give that person exercises, nutrition, and stuff. How do you get them to continue it forever?
Sure. Well, the key is, that's exactly what it is you want to find a way to integrate it into this person's life. I brush my teeth every day. I don't miss a day because it's become a routine. It's become a habit. And it's taking these other things that would be a healthy habit and finding a way to integrate it. So maybe do these simple exercises every night after dinner. Or every morning when you wake up, you should do these stress relieving activities. Things like that, so it's already built in, it's programmed. We're creatures of habit, right?
We are.
So if we can make it a habit, it's going to make it easier for us.
Yeah. Well, what did you bring to show us?
Sure. Well, of course, you can't be a chiropractor without a spine. I take my spine everywhere because I'm not spineless, right?
Oh, you sound like Tom Clark, our director.
Okay.
We'll have to remember that.
Forgive my bad joke.
Okay.
But I like to use this as essentially just a visual aid, a tool, so people know what's going on inside their body. I mean, we take great care of our teeth because we can see them. I say we'd take better care of our spine if we could see it, right? So this is basically just a model to show the bones of the spine, the spinal discs, which are in between each vertebrae of your spine.
Where are the discs?
The discs are these small things right here in between each bone. Basically act as cushioners to make sure our joints work well and just basically help them move. Because if this was one stiff and rigid bone, we wouldn't be able to move. We put the disc in between there. It's basically a shock absorber. So that's the way the system works. And the nervous system is very closely related to the spine. All these nerves come out from the different spinal levels and go to every muscle, cell, and tissue in your body in order to coordinate motion and coordinate movement.
And it comes from, you said, the brain.
Oh, absolutely. It's the central nervous system. So first we go from the brain to the brainstem and the spinal cord, which is our central nervous system comprised there. And then as we go out to the periphery, the peripheral nervous system, which is the exiting of those nerves from the spinal cord, going out to the other areas of the body.
So tell us more about that. I mean, like if somebody has a slip disc,
Sure,
where would
absolutely.
that be?
Well, there's actually an example on the spine in a lower area here, if we can get it, this red area here. So when someone's talking about having a slip disc, basically the disc is known to protrude posteriorly and laterally, okay? When it does that, it directly affects the nerve. So people will get maybe a numbness or tingling sensation. Also, it can become even worse to where maybe their nerves or muscles aren't contracting properly. So they can get that painful sensation. There's actually techniques you can do that are non-surgical to reduce that disc herniation or disc bulge or the slip disc and get it to actually centralize back into the area where it came from to reduce those symptoms.
How would you do that?
Yeah, through a lot of it's decompression, chiropractic adjustments specifically to that area to manipulate the tissues in and around it, and then specific exercises that are going to help to encourage it to basically go back in between the bone, the vertebrae, and the spine.
Well, you know, that sounds so much better than going to, I don't want to put down surgeons,
Sure.
but you know, where they want to operate on you right away, and then what happens?
Absolutely.
Yeah.
It's a conservative therapies first is always your best idea. If you have an ailment, try chiropractic first. Yeah, if it doesn't work for whatever reason, surgery is always an option. Drugs are always an option. They won't ever go away, but I would say this is most conservative typically. Try it first. That's what I'd recommend to my family and friends. So.
Did you ever have a disc problem?
Oh, it wasn't a disc problem, but I did have a spinal problem, which is how I ended up becoming a chiropractor, actually.
I was going to ask you that.
Sure.
Could you tell us that?
Sure, absolutely. When I was 15 years old, actually, I was training for football, trying to get in shape, and I threw my back out, as they say. All I know, I was lifting some weights, doing a power clean, and I felt just excruciating pain in my back. I couldn't function at all. So my mom, being the fantastic mother that she is, takes me to my medical doctor at the time, and he just kind of said I was going to have back pain for the rest of my life. And I was 15 at the time. I thought I was a decent athlete. I love sports. I was going to try to go to college and play sports. But I couldn't play through the pain I was having. So thankfully, he sent me to a physical therapist, and that physical therapist worked very closely with a chiropractor. And with the two of them doing their therapies, I got better. So.
Without any surgery?
No surgery, no drugs, just just the techniques they learned.
Is that really what led you to your profession?
Yeah, partially. It's kind of a threefold story. That's a portion of it, just because I was 15 at the time. I didn't know what career I was going to go into. But I loved the idea behind it. And then when I was in college, we were asked to write a paper on a potential profession we'd want to go into. And I said, hey, why not chiropractic? And the more I studied about it, the more I loved it. Just the whole philosophy. It's, no drugs, no surgery. Your body's an amazing machine that it can heal itself. Let's eat better. Let's move properly, and let's decrease our stress levels to optimize our body's natural healing. So
tell about, I mean, I'm making this up. Say a person comes in, say a woman.
Absolutely.
And she's just about to have a nervous breakdown.
Sure.
The rest of her body's okay. What would you do for her?
Sure. Well, it depends. It's kind of,
I mean,
a lot of things can be causing it.
Yeah.
She's very stressed out.
Yeah.
She comes in to talk to me.
Yeah.
Well, first, I'm just going to talk about her day. Did something happen today? Typically on my intake form, I just have simple questions that say, is work stressful to you? Is your family life stressful to you? Where's the stress coming from? Because the key is you want to get to the cause of the problem, right? Because we could mask the problem all day long and say, well, hey, you need to go do this or that. But really, what's causing it? If we can stop the cause of the problem, then hopefully it won't come back and we can provide some solutions. But I would address it first by just asking those simple questions, then do some sort of therapy, whether it be the nutrition, the exercise, or the chiropractic adjusting, or just talking,
Could you tell us a little about the chiropractic adjusting?
Oh, sure, absolutely.
Yeah, could you show us on that?
Oh, I can try.
Okay, because I don't do chiropractic.
Absolutely.
But I may now. But.
Sure. So
Yeah.
basically, we work with subtleties. The spine is a very, very, very intricate. I look at it as an organ just like a liver or a heart. It kind of works together. It's just a little symphony going on right in here. All these motions and movements being coordinated. So what I do is I go in and I palpate the spinous processes and the transverse processes and the...
What does that mean?
I'm sorry. It's this bone right here.
Yeah.
So this is the spinous process of this vertebrae. Each vertebrae has one. And then these two side portions here are the transverse processes. So I'll go in and feel and say, are these things moving properly? Because physiologically, these joints, they're designed to move. So is it the right amount of movement? Is it too much movement in an area? Is it not enough movement? Are the muscles tight around there? Are they stretched out? Is that what's creating your pain or symptom or something like that? So then I'd go in and just make a contact to that area, whether it be, there's various different contacts that you can use. But I just go in and I would feel where those restrictions were, and I would adjust it just like that. It's really very subtle motion. Just kind of lean into it, and just if you know how to do it and where these things are supposed to go and which motions are restricted, it's just a matter of technique.
You make it sound so simple.
Well, I was very well trained.
Because you're very well trained. Why do you like your profession so much, Preston?
Well, I think part of it is, like we spoke about earlier, is that it very much resonates with my personal philosophy. Even when I was a kid, I didn't take a lot of medications. Granted, that pharmaceutical intervention, when necessary, is great. I mean, it works well. That being said, I think it's overused. People have a pill for every ill. You know, they want magic bullets and they want simple solutions to their problems, when in reality they need to get down to the root and the cause of the problem. Maybe this is being created by something in your diet. Maybe it's being created by the way you're sleeping at night. You know, as opposed to just saying, I'm going to take a painkiller, how about we say, why is the pain there? Let's prevent it from coming back.
So the woman that comes in is horribly stressed. But she doesn't seem to have any, back pain or anything. It's all up here. What would you do for her?
Sure. Well, once again...
I'm asking you such a general question, but, would you start with finding out about her physical, self?
Well, you want to kind of hone in on which system's causing this, right? So people can be highly anxious or stressed because their adrenal system is working in overdrive. They could be chronic inflammation is something that's going around in a lot of people due to our sedentary work habits. We sit a lot, and then our dietary habits as well, causing this chronic inflammation. And if we can, through some supplementation, reduce that inflammation, change some things in the diet, it can have an effect on the stress levels as well, because it's basically our body gets hyperactive.
And what about the diet? You mean Kentucky Fried Chicken stuff?
Yeah, well, I live by the 80-20 rule.
What's that?
Which is 80% of the time, do what you're supposed to do. 20% of the time, live life and have fun, right? If we treat our nutrition the same way we treat our finances, I kind of like that analogy, because if you save and you do well with your finances most of the time, you're going to be okay. Then if you want to splurge and go to Tahiti sometime, you'll be fine, right? Just like eating food. If you're, eating lots of fruits, lots of vegetables, lean meats, nuts, seeds, fish, and fowl, 80% of the time, you'll be good. Then if 20% of the time you have some ice cream, maybe some potato chips, maybe, it's not great, but it's better than having it every day. And it's just kind of the story I kind of live by.
Okay, I think it's time we promised the audience some of your exercises.
Absolutely.
And we'll do sitting down exercises,
Sure,
okay?
absolutely. We'll do that.
Okay.
All right, so
I'll just follow you.
We live in Silicon Valley, right?
Right.
So a lot of people are sitting down at these desk jobs. I think, what are some simple solutions to reduce some of these physical stressors, essentially, is what it is. So one of the things I do is a posture relief exercise. You can do it sitting or standing, where we want to just turn our palms out like this. I want my arms to just hang down as much as they can. Just nice and free floating. Just let the arm just hang all the way down. You want to reduce the tension in the traps there.
Yeah.
Perfect. And then we want to just bring our head back like this. So basically tuck your chin down a little bit, and then we call it a long reaching. So you want to make your neck as tall as it can be. And what you'll feel is it really shuts down the muscles here. From a neurological standpoint, these muscles get overworked with a lot of the positions that we use. So encouraging people to do that posture a little bit each day. Another thing of the
That's
workstation.
that's just
as simple as that. Simple solutions, right? Have you heard of the KISS principle?
No.
Keep it simple.
Oh,
Stupid.
I like the other one better.
That's the principle it goes by. We don't need to overcomplicate nutrition. We don't need to overcomplicate these exercises. Just keep it simple.
Okay.
Another one is to, at your workstation, take a 30-second to 1 minute break once or twice an hour. Get up, walk around, go to the water cooler. You don't have to take all day, but it prevents your muscles from becoming stagnant. When they get short and tight, it's going to create a lot of these pain syndromes that people experience. Also, here's a simple stretch. A lot of people have the carpal tunnel syndrome, right? We've all heard of that. So if we just stretch out a lot of these muscles that we're using, it's creating a lot of tension in that area. It's going to help reduce that, because essentially the carpal tunnel is right here in this region. If it's resting on a keyboard or mouse pad a lot, it can get inflammation and some wear and tear in there.
You just push it out.
A simple stretch like that is going to stretch the forearms and stretch all the tissue that's right there.
Okay.
Some good simple exercises right there.
We need some more. A lot more.
I've got a Rolodex in here.
Oh, okay. Yeah. Okay, do some more, please.
Okay, sure. Yeah, simple neck exercises that people do. A lot of times, once again, the traps are really tight. So if we just turn our neck at about a 45-degree angle and then just bring our chin down to our chest and just gently pull down on our head like this. You feel the little stretch in the muscle there on the side?
Yeah.
And that's one of those muscles that really gets overworked. It's a simple thing you can do, and then you can also do the stretches from just side to side. One side, and the other side, and then straight down.
Right?
All of them. I say they probably use it in yoga because it works. The truth is the truth is the truth. It doesn't matter which practitioner is teaching it as long as it works, right?
Do some more. Come on.
Do you have a bench press in here? I'm just kidding. Well, a door frame exercise is one that I like to do. We actually stand in a door frame and bring your arm back like this into the door. So pretend like your hand is hooked on a door frame.
Okay.
And you're leaning in. So bring that arm back even farther. Even farther. There you go. And you feel the stretch in here.
Yeah.
So you want to get the front. A lot of times people will it's essentially be in this position a long time during the day, and we want to reverse that to restore that posture. We do that by typically stretching something that's going on in the front and then doing some strengthening exercises for the back.
What about some leg ones? Can you demonstrate?
Oh yeah, the legs are a little tougher when you're at your workstation. Typically, I would say if you have like a little band or something, you could to give some resistance. A simple leg extension exercise like that. Go back and forth. Or if you want, you can just hold your legs up like this. That's an isometric exercise. Contracts the quads. It's going to promote some blood flow there too. Simple stuff like that. It's just not allowing things to get stagnant and sit still for too long.
What's your favorite exercise?
My favorite exercise. Honestly, if everyone would walk for 30 minutes a day, we could reduce cardiovascular disease, we could reduce diabetes, we could reduce cancer by leaps and bounds. So walking, simple solution, absolutely, hands down. We're machines that are designed to work and move and play, and unfortunately we sit behind desks all day long now in many of our occupations, right? So if we just take the time to go on a walk 30 minutes a day, it's going to reduce, your need for a lot of these therapies. Do
you have to walk fast?
No.
In other words, it's just the fact that you're moving your body, so it doesn't have to be power walking or anything.
Nope. If you do a brisk walk, it's better, but it doesn't. If you just get out and move, it's going to be great. Yeah.
Let's talk about some of the styles that the women are going through with the stiletto heels.
Let's talk about that.
Tell me what you think about those wretched shoes.
Well, the thing is, I won't say it's terrible, okay, but in moderation, right? If there's just some different research and articles out there that I've read showing how you can promote, some ankle and foot problems, pelvic problems, and also lower back problems by wearing the high-heeled shoes. Basically, it's going to shorten the calf muscle, can lead to some damage to the muscle itself, some tendons and ligaments. Then also, it can be damaging to the spine as well just by assuming that posture. So it's kind of like weightlifting, you don't want to do it all day long. So if you're on your toes all day long, you're just constantly working those calves. So I'd say you want to wear them a couple days a week, that's okay, but try not to do it all the time.
Yeah. I gave those up a long time ago.
There you
Well,
go.
think about the ballet dancers, how their feet are ruined
Oh,
forever.
so many of them have fantastic chiropractors, I tell you that.
They
Because we
do.
work on lower extremity problems as well, whether it be foot or ankle, things like that. But then it also affects the back, right? It just comes right up that chain.
Yeah.
But yeah, they do tend to have a lot of foot problems.
In your practice, what are the biggest problems that you've had?
Sure. You mean what patients typically come in with?
Yeah.
Typically, pain is a great motivator, right? That's what I find. Someone could have a problem for a very long time, but until it starts creating pain, they're not going to do anything about it. I know plenty of people who have had, some of the big three, like I mentioned earlier, cancer, diabetes, and heart disease, who didn't feel any pain or any symptoms, just all of a sudden they had a heart attack. But in reality, it didn't happen all of a sudden, right? It happened over a long period of time of maybe not doing the things right. That being said, headaches, neck pain, back pain. Those are the big three things that typically people come into a chiropractic office for. Just because I don't know if it's just difficult to find solutions elsewhere or if chiropractors are just kind of positioned and known to be the specialists in that area.
I just think it's great that we've had this program because I just, the way you have explained everything, Preston, and the fact that, like, we go to the dentist, why not a chiropractor? But what if you don't have a good chiropractor?
I would say it's like any other profession. If your car breaks down and you go to a mechanic and they don't do a good job, you ever going to get your car fixed again?
Never. Well, I'd have to.
You'd have to.
I'd have to, but I have
Exactly
to
right.
find
So
somebody else.
that's exactly, and I would encourage you to do that with anything. If you go to any professional and they don't do a service, they don't render it the way you deem necessary, I'd find somebody that does and someone that you do like. And
so you do say a person just goes to you, and you work on them, and then that you're through. You say you have to have the right nutrition, and please do the exercises. And supposedly they're done, but they're not. Are they? I mean, I'm asking you.
Sure. Well, it's up to the patient, really. Some people come in just for an acute type care, like I'm in pain, I want out of pain. Some people say, you know what? It feels really good when I come in here and you do whatever you do. I'd kind of like to do that on sort of a regular schedule. And I say, yeah, it might not be a bad idea because it's probably going to prevent some of this stuff from coming back.
Really?
Absolutely. And it's just the same as anything else, just like we mentioned with brushing your teeth and dentistry and your diet and eating right.
Well, I think it's so illuminating what you've said because I really did not know that much. I know about physical therapy, which is fantastic.
Absolutely.
If you have the right ones. But then, it's the same thing. Am I going to continue doing the exercises? No. What's going to encourage your patient to do that, to really keep himself or herself in good shape?
All we have in this life is choices.
Yeah,
if you don't make time to stay well, you're going to have to make time to be sick. You get to choose. Either I'm going to do the right things now in order to stay healthy, or you're putting yourself in a position to have to think I'm going to sustain an injury or this pain is going to come back, and then I'm going to have to address it again and maybe miss work or not be able to pick up my kids anymore, not be able to get in and out of my car, when in just reality, if you'd been doing it all along, it would not come back again.
So you would emphasize the diet, nutrition, exercise, and going to see you.
Absolutely. Find a good chiropractor. That's all I can say.
I know. This isn't a commercial, but really, you have been so you've given such good information.
Thank you.
And I really wish you very well. We have a couple more minutes, but
I appreciate it.
I think I asked you, but I'm going to ask you again. What really turned you on about your profession?
Yeah, it's the holistic approach, I think. Addressing things by saying, for instance, if the woman comes in who's stressed out, I'm going to look at the whole package. If Suzanne comes in, Suzanne is a person who has a condition, not just a condition. right? So I'm going to look at what's going, I'm not just going to treat X condition, I'm going to treat you as a person. What would I do to optimize your healing? And the condition oftentimes will subside if we take care of those factors.
And that makes you feel good.
Makes me feel fantastic. That's what I love. It's not trying to name and blame things. You know, oh, well, you have this, so let's do this. But just saying, if we treat this person right, there's nothing like taking somebody from one level of health to another level of health. That's what gives me the most joy more than anything else. Either they don't feel well and now they feel better, or they think they feel pretty good and now they feel great. That's typically what my job consists of, and they pay me to do that. That's pretty cool.
Does insurance pay for you?
Yeah, absolutely.
Oh, really?
Yeah, insurance covers chiropractic care most of the time. Different policies do and some don't, but most people have insurance coverage if they have insurance.
If they have insurance.
That's a whole other debate right there. 50
right.
million Americans or something, no insurance.
Well, you're a young, very intelligent, handsome guy.
Why, thank you.
Who must be a wonderful doctor.
Thank you very much.
And I don't even have to wish this. It's already here.
Fantastic.
So thank you again.
Thank you very much for having me.
I do wish you great success.
That's great. I love sharing.
And you really explained so much to me and to the audience. Sure. Speaking of great things, we have a fantastic crew. We do. And it's all volunteer. KMBT is such a wonderful facility. And I so appreciate being here. And mostly, I just hope that our audience enjoys our show. And I always say this because I mean it, like you know how you mean what you do. I just can't wait to see you next time. Bye-bye.